So first I'm going to start off by just washing my hands. Hi, my name is Maggie. I'm the nurse practitioner student that's going to be examining you today. Hi. So we're going to start off where we left off last time. So I'm going to be examining your stomach, abdominal cavity first. So I'm going to have you just lay down. I'm going to come on to your left side. So I'm just going to pull up your tank top. And first I'm just going to start off by just looking at your abdomen. So looking at the shape of it, the contour, if there's any distension, if there's any scars, any pulsations from the vessels, any masses or protrusions that might be visible, and everything looks good. And then I'm going to go ahead and just listen. So first, just listening in all 4 quadrants for bowel sounds, and making sure I can hear them every 5 to 30 seconds. Okay, good. And then I'm going to go on and listen to the vessels and the abdomen. So listening over the aorta for bruit, the renal arteries bilaterally, the iliac arteries, and the femoral arteries. Okay, good. So everything sounded great, and I'm now going to go on to percussion. So just percussing the entire abdomen. Should be mostly tympanic because the bowels are full of air, and some dullness over the organs. Good. Now we're going to go on to percussing the upper and the lower borders of the liver. So I'm going to start off over from the umbilicus and start percussing and listening from where it goes from tympany to dullness, and marking that, and then going down, and listening from where it goes from resonance to dullness, and marking that. Should be about 6 to 12 centimeters. Okay, then we're going to go over and percuss the spleen. So going over mid-axillary line on the left side, and percussing, trying to hear dullness. And if I can't hear it, I can have you take a deep breath for me and see if that spleen drops, and if the percussion changes from tympanic to dullness. And lastly, I'm just going to percuss the bladder. So just percussing, checking for any bladder distension or dullness. Okay, good. So now we're just going to move on to palpation. So I'm just going to palpate lightly all 4 quadrants, checking for any pain, any masses. Any pain with that? No. And then I'm going to move on to just palpating the femoral arteries, checking if I can feel that pulsation. And while I'm down here, just palpating the inguinal lymph nodes. Again, checking for the size, consistency, if they're enlarged, if they're mobile, and any tenderness. Any tenderness? Good. Okay. Then we're going to move on to deep palpation. So deep palpating the entire abdomen. Again, checking for any masses I might not have felt. So going a little bit harder. Okay. Then I'm going to palpate the spleen. So I'm going to use both hands, and I'm going to try and feel the liver border. And I'm going to go up and in. And I'm going to ask you to take a deep breath, seeing if that liver comes down. Okay, good. And then I'm going to palpate the spleen. So again, going on the left side and palpating. And I'm going to have you take a deep breath again, trying to feel that spleen. All right, the last thing I'm going to palpate is the kidney. So I'm going to put my hand behind your back, and I'm going to push that kidney forward and palpate it in the upper quadrant. Okay, and then same on the other side. So pushing that kidney forward and trying to feel any pain. No. Good. And usually the right kidney is easier to feel than the left. Okay, so we're done with the abdomen. We're going to move on to the musculoskeletal exam, so I'm going to have you lay for a little bit longer. First, I'm just going to examine your lower extremities, so just checking for any tenderness, any redness, any pedal or pretibial edema. Everything looks good. And now we're going to go into range of motion. So first I'm going to check the range of motion of your hip. So I want you to kind of just kick your leg up in the air like that. Good. And down. So that's flexion. And then up again. Good. Flexion, extension. And then I'm going to have you kind of lift this leg up and kick it out to the wall. Good. So abduction and then bring it back over. Good. Adduction. And then same on this one. So out, abduction, and then back in, over, adduction. Okay. Then I'm just going to check the internal and external rotation of the hips. So I'm going to have you just kind of bend your knee in. Good. And then just turn it. So internal rotation and external. Any pain? No. Okay. And then same on the other side. So internal and external. And then we're just going to check the strength of your hips. So kind of just kick your legs up. This one good, this one, and then lift them up and push it down, and push it down. Good, and then kick them out and in. Excellent. Good strength. And you're just assessing strength if they're similar in both extremities and on a scale of 0 to 5. So then we're going to go on to the knee. So first I just want you to kind of kick your knee in and then out. So flexion, extension. Same on the other one. Any pain? No. Okay, good. And then we're going to do internal and external rotation of the knee. So having you bend it again and then bringing it in, internal and external. Good. And then again, internal and external. Okay, and then just assessing the strength of the knee. So again, kind of just bend your knee and then kick out. Good. Kick in. Good. And then again, kick out and in. Good. So then moving down to the ankles. So I first just want you to kind of flex your feet up towards your head. So dorsiflexion, point them down. Plantar flexion, put them in, put your toes kind of in. Good. Inversion and then out. Eversion. Excellent. And then we're just going to test the strength. So push up and down. And then can you do out at all? Good. And in. Good. And then lastly, we're just going to assess the toes. So first just wiggle your toes for me. Good. Any pain? No. Good. And you don't have any hammer toes or any deformities, which is great. And then lift your toes up and down. Good. And great strength. Okay. So now you can sit up. We'll come around this way. So now we're going to do the upper extremities. Again, just looking at them, checking for any deformities, any arrhythmia, anything like that, and everything looks good. So then we're going to go on to palpating the acromyoclavicular joint. Any pain? No. Good. And then the lateral and medial epicondyls. Any pain? No. Same on the other side. Any pain? Good. The wrist. Any pain? Mm-mm. Good. And then down to the hand. So checking the DIP, the PIP, and the MCP joints. Checking for any inflammation that might be here, any redness, any tenderness. Everything looks good. Okay, so now we're going to do range of motion of the shoulder. So first I want you to just kind of bring your arms up. Good. So that's abduction. Then we're going to do adduction. So put them to your side and you're going to kind of go like this. Good. So adduction and then same on the other one. Any pain? No. Good. And then we're going to do internal and external rotation. So with your opposite hand, I want you to put it on the opposite scapula. Perfect. Any pain? No. Good. And then same on the other side. Good. And then lastly, we're just going to do flexion and extension. So just out, flexion, good, and back, extension. Excellent. And then we're just going to test strength. So put your arms out like that. Good. Can you push them up and down? Good. Bring them up forward towards me. Good. Up and back. Good. And then we're going to move down to the elbows. So first I just want you to kind of make like you're making a curl. So good, flexion and back down, extension, excellent. And then we're going to do supination and pronation. So kind of bend your arms like that and then just turn your hands up and down. Supination and pronation. Any pain with that? Good. And then we're going to test strength again. So just kind of curl this in if you can and out. Good. Good. And then we're going to go down to the wrists. So first I just want you to kind of bend them like this. Good. Flexion, extend them. Good. And then can you adduct them? Good. And then abduct them. Good, and then make a fist for me, and we're going to test the strength. So push up, push down. Can you push sideways? Good, and this way. Good. Okay, then we're going to move down to the hands. So first I just want you to spread your fingers. Good, so that's abduction, bring them together, adduction. Can you make a fist again? Flexion, good, and then out again, extension, great. So then I just want you to squeeze my hands as hard as you can. Good, and both are the same. Okay, and then spread your fingers again, and I'm going to try not to have me close your fingers. And just testing the strength of your fingers, good. Okay, that's great. So the last thing we're going to do is just opposition of the thumb. So with your thumb, I want you to hit the finger pad of your pinky and then each finger pad after, exactly. Good. Any pain with that? And then just testing the strength of your thumb. So I'm going to come over here and kind of try and hold it back and try and hit it to your pinky. Good. And then same on this one. Good. Okay, so that's it with that. We're going to move on now to the back. So we're going to look at your spine, just checking the curvature of your spine, checking for any scoliosis, kyphosis, or lordosis. And yours looks good. It's nice and straight. And then I'm just going to palpate the spinal processes. So the cervical, the thoracic, and the lumbar. And checking any pain with that? No. Good. And then lastly, I'm just going to palpate the paravertebral muscles for any pain or tenderness. Any? No. Okay, good. So the last thing we're going to do is just do the neurological exam. So I'm going to ask you some questions. First, can you just tell me your name?
Aisha.
And where are you right now, Aisha?
In apartment in Arlington.
Perfect. And can you tell me today's date?
4/1/2015.
Good. And what day of the week is it?
It is Wednesday.
Wednesday. Okay, perfect. And then can you tell me what it means to not judge a book by its cover?
You shouldn't look at people from the outside, but what they are for in the inside.
Perfect. And I'm just testing your reasoning with that. And then just testing your recent, your remote memory. Can you tell me where you went to elementary school?
Bonnie Bry.
Good. And can you tell me what you ate for dinner last night?
Chicken and rice.
And what was the weather like today?
Sunny and 65.
Okay, perfect. And then the last thing I'm going to ask you to do is just count backwards from 100 by sevens. And this is just called serial sevens, and it's checking to see if you can do that.
Okay, so 100, 93, 85, and 78.
Okay, perfect. And if we could have longer, we'd go all the way, but that sounds good. Okay, so now we're going to go on to just testing your cranial nerve. So first just doing cranial nerve 2, which is the optic nerve, and I'm just going to be testing your confrontation. So I'm going to be testing your peripheral field of vision. So I want you to look straight at me and tell me when you can see my fingers wiggling in your periphery, okay?
Mm-hmm. No. No.
No. Okay, good. And then we're going to move on to cranial nerve 3, 4, and 6, and just checking your extraocular movement of your eyes. So just follow your finger with my eyes, with your eyes, do not move your head, okay? Okay, good, and I'm just checking for any nystagmus, which may or may not be there. You don't have it, and you're able to follow them correctly. Okay, so now we're going to move on to the cranial nerve 5, which is trigeminal. There's 2 parts of it. It's the motor and the sensory. We're going to do the sensory first, so I just want you to close your eyes for me and tell me if you can feel when I'm touching you, if it's the same on both sides, if one side is felt more than the other, okay?
Same. Same. Same.
Okay, so just putting my fingers on your forehead, your cheek, and your jaw, and checking if it's the same bilaterally. Okay. Then we're going to do the motor part of that nerve. So I'm going to be just putting my hands on your temples. I'm going to ask you to clench your jaw. Good, and I can feel that clench. And then on your masseter muscles right in front of your ear, clench your jaw. Good, and then can you just move it side to side? Any pain? Okay. Now we're going to move on to cranial nerve 7, which is the facial one. So I want you to kind of puff out your cheeks. Can you smile? Can you frown? Can you elevate your eyebrows? And can you close your eyes tight without me opening them? Good. Okay. Now we're going to move on to the cranial nerve 8 acoustic. There would be 3 tests in this. The first one's going to be the whisper. So I want you to just cover your ear with that finger, and I'm going to whisper something and just tell me what I'm whispering, okay?
A1C.
Good. And then same on the other ear.
B2D.
Perfect. Okay, and now we're going to do the Weber test, and this is just testing for lateralization, that you can feel the vibration in both ears the same. We're going to pretend that this is a tuning fork, so I'm going to go ahead and hit it. I'm going to put it on top of your head, and if it was, would you be able to hear the
Yes.
vibration? Perfect. And then we're going to do the Rhine test. So again, pretending this is a tuning fork, hitting it, putting it on the mastered process. You would tell me when the vibration stops.
Stop.
And can you still hear it?
Yes.
Okay, and that's making sure that air conduction is greater than bone conduction. And then same on this side. Tell me when it stops.
Stop. Yes.
So then the next cranial nerve is cranial nerve 9 and 10 is testing for the gag reflex. I'm not going to do that, but if I were to do that, I'd have you open your mouth. I'd have you stick out your tongue and say ah, and then I would stick something in the back of your throat to make sure that you can gag. Okay. So now we're going to move on to cranial nerve 11, which is the spinal accessory. So I want you to just shrug your shoulders against my hands, good, and then turn your head, good, and this way. Excellent. And the last cranial nerve is cranial nerve 12. I just want you to stick out your tongue, move it side to side, and then just checking for articulation, I want you to say ka,
Ka.
and go.
Go.
Perfect. Okay, so now we're going to just do some tests to test cerebellar function. So first I just want you to put your hands on your knees and just rapidly alternate them. Good, and I'm just checking the rate, the rhythm, that they're symmetric, any difficulties with that. And then really quickly just do your fingers to your thumb exactly like that. And again, noting the rate, the rhythm. Perfect. And then I'm just going to, at rest, just assess for tremors. And you don't have any, which is excellent. And then I'm going to ask you with each hand to go ahead and grab this. And I'm assessing for any tremors with intention, which you don't have. Good. Then we're going to go ahead and do position sense. So I want you to go ahead and close your eyes. I'm going to be moving your toes and your fingers, and you're going to tell me if it's up or if it's down, okay?
Up. Down. Up. Down. Down. Up. Up. Down.
Okay, good. Okay, and then the last thing we're going to do is the finger to nose. So you're going to be touching your finger to your nose and then touching your finger to my finger, okay? Good, and then same with the other hand. Okay, good, no difficulty. Okay, so now we're going to just test for sensation. So I'm going to bring this stuff over. The first 2 tests I'm going to do, I just want you to tell me if, close your eyes and go ahead and tell me if what you're feeling is sharp or if it's dull.
Sharp. 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 Sharp.
Okay, good. And then same thing, sharp or dull.
Dull. Dull. Dull. Dull. Dull. Dull. Dull. Dull. Dull. Dull.
Okay. And then keep those eyes closed just for a little bit longer, and I just want you to tell me when you feel something touching you, okay? Just say now.
Now. Now. Now. Now. Now. Now. Now. Now. Now.
Good, and I was just testing to see if you can feel light things. Okay, so keep those eyes closed just a little bit longer. I'm going to test for object recognition. So I'm going to put something in your hand and just let me know what you think it is.
Coin.
Great. And then same with this one. What do you think this might be?
Pass.
Excellent. Okay, and the last thing I'm going to do is just test for vibration. So again, pretending this is a tuning fork, I'm going to put it on your toe, and you would tell me if it feels like a vibration or if you just feel pressure, okay?
Vibration.
Good.
Vibration.
And then doing the same for the fingers.
Vibration. Vibration.
Okay. All right, so you did great. You can go ahead and open your eyes. The next thing we're going to do is just test for reflexes. So I'm going to start off and just by testing your biceps. Good, making sure that it contracts, and then your triceps. Good. And your brachioradialis. Okay. Again, over here, biceps, triceps, brachioradialis. Okay, down to your patella. Good. And then over here to the Achilles. Seeing that it goes down. Good. And then while I'm down here, I'm also going to check the plantar reflex, which I'm going to take the bottom of my instrument and I'm going to go on the lateral aspect and in. And if this was positive, that would be abnormal for your age. And just checking for the Babinski sign. Okay, good. So I'm going to, last thing we're going to do is I'm just going to have you stand up. Go ahead and just kind of walk towards me. Good, and then walk back and do heel to toe. Good, and then can you walk on your tippy toes? And then back on your heels. Great, and then we're just going to check lateral bending. So I want you to kind of bend forward and back, and then side to side. Any pain with that? No. And can you twist? Okay. And the last thing we're going to do is just the Romberg test. So I want you to go ahead and close your eyes, and I'm just checking for any swaying or loss of balance. Okay. You did great. Thank you so much.